Your critical dedication to discovery at the University of Maryland School of Medicine propels us to a national and global leadership role. Our research enhances both the educational experiences for students as well as our clinical care. We give hope to patients who were hopeless yesterday. At the University of Maryland School of Medicine, we are changing the trajectory of what is possible.
It wasn't all that long ago when babies who had heart disease that was this severe weren't expected to live beyond the first couple of weeks of their lives. And it's really a function of research that's been done in many different areas that has allowed children who have such serious heart disease to not just survive, but thrive.
Shania was born with only one chamber to her heart, the right ventricle, which by itself doesn't have enough strength to pump blood efficiently throughout the body.
0.5 now?
Another 0.5.
Dr. Sunjay Kaushal has done 3 operations on her, and as part of a clinical trial, he injected stem cells into her heart during the second surgery.
Our premise is that the stem cells will regenerate or remodel the heart. In doing so, the heart will pump blood more efficiently through the body. So that will make these little babies have better surgical outcomes and live longer with their heart condition. Good morning. How are you?
Good morning. Hi.
How's Precious doing?
She's fine. She's doing awesome.
We're feeling that this type of therapy is going to be game-changing events for our children.
The whole stem cell thing, my husband was all for it anyways. It's something that could sustain her quality of life and keep her with us as long as possible. Anything for my baby girl, you know.
This is a stunning application of stem cell research, starting with the patient, leading back to the laboratory bench and the isolation and study of these cells and how they work.
Precious.
To give them to patients with severe congenital heart disease.
Yes, it is the future of medicine. I think that sometimes people think this is science fiction, but I have to say now it's reality.
These advances have involved research that's resulted in really the unbelievable strides that have happened in the last 2 decades. What you're seeing is the result of biomedical research and love. And love.
Definitely.
Yeah.
Just thank you. Thank you for everything.
University of Maryland, from day one, focused on the importance of research.
It was really exciting to me to use that research to design an experiment and actually see it through and see the results.
How are those numbers?
Hey.
Today, students in medicine want to be part of the evolving world of medicine. Research, an integral part of the School of Medicine curriculum, provides students with the tools they need to do this.
This education has been worked into the curriculum at all levels of student education. Our primary objectives are to teach critical thinking, and we also hope to stimulate or, in some cases, foster an existing scientific curiosity, which we hope that students will take with them in their future careers.
So where do we want medicine and research to go? And rather than them being 2 separate camps, competing camps, bringing them together.
The patient care and medical treatment is always evolving, it's always changing. And not only is it important to be knowledgeable, be up to date on it, but I also think it's important and almost a duty to be a part of that change, to be part of finding new knowledge and help develop the patient care to help all those patients.
Already recognized by a prestigious NIH award, Josh's research focuses on identifying new treatment approaches for HIV.
So you can see how it's very fascinating and interesting on how such a small area has a huge effect on the whole genome. And you can see how in the future that this small area may be a highly attractive target for future therapeutics. It's almost, this small region could be like the Achilles heel of HIV. And my project is a step towards that goal.
For Elena, her research experience has redefined her understanding of medicine.
Well, I think that this next kind of era of medicine, you're definitely going to have a lot more clinicians also do research, whether it be at the bench or the bedside.
I think it's not just wanting to apply what's known or been tested already, but to be part of the discovery process. They take great pride in it. They want to be part of the solution.
Dr. Kathleen Newsill, director of the University of Maryland School of Medicine's Center for Vaccine Development, is recognized as one of the world's most influential advocates for vaccine development and global policy.
So we've seen the full circle. Vaccine developed here, tested here, licensed, and now we're distributing it.
It's licensed and approved, yeah. So now what we'd like to do is see if we can deploy the vaccine into developing countries. We've completed the initial study in Mali, and now we'd like to do more studies in sub-Saharan Africa.
Yeah, so that's fantastic. So it's here in the United States, it's being used, and now we have plans for the research that's needed so we can bring this to the rest of the world.
Exactly.
Vaccines have been a focus my entire career because of their power to, again, prevent disease and prevent suffering and prevent death. And I think they have been called one of the medical miracles of our time in terms of the impact they've had on human health and disease.
With globalization accelerating the spread of viruses from country to country, the center's mission to reduce morbidity and mortality of vaccine-preventable diseases has never been more important.
So we are a research center that really runs the entire spectrum from developing vaccines right here to understanding the immune response to those vaccines to testing those vaccines both here in the United States and internationally. So the entire spectrum of what it will take to get a vaccine into a human and prevent a disease.
Always on alert for epidemics, such as the recent outbreaks of Zika and Ebola, the Center for Vaccine Development collaborates with the CDC and NIH, instantaneously responding to outbreaks.
We are really able to respond because we have such an infrastructure. It stretches from the basic science to the deployment of vaccines. So we have the ability when a new pathogen, a new virus emerges, to be able to have surge capacity.
With hundreds of thousands of children dying without access to vaccines, a key mission of the center is making vaccines available worldwide.
I travel quite frequently to these countries. I have been able to receive the most positive feedback anyone can receive when I go to these vaccine clinics, and I actually see infants receiving vaccines that I have helped test and change policy for. So it's wonderful to see that, but you also see that there's a lot more to do.
As the new chairman of the Department of Neurology, Dr. Peter Creno's dynamic vision of research frontiers addresses the most challenging of neurological diseases.
We need to build a program in Alzheimer's disease, vascular dementia, and frontotemporal dementia, so we are currently working to establish a program in neurodegenerative disorders, which would be essentially a center-based approach to cover dementias of all different types, as well as Lou Gehrig's disease or amyotrophic lateral sclerosis.
Research on pediatric neurological disorders, including Dr. Creno's own area of expertise, will focus on malformations of the brain during embryonic development.
The brain forms over about a 12-week period of time. During that time, gene mutations can occur that cause abnormal formation of the brains. These include epilepsy, intellectual disability, and autism. So my lab is interested in understanding the molecular genetic underpinnings of those malformations. And in some really, I think, interesting studies in the last few years, how we can target those gene mutations using a precision medicine-based approach.
These newly developed techniques will make possible treatments for neurological diseases which have never before been possible.
It used to be sci-fi, now it's just science.
Hi, how's it going, Virginia?
For Virginia Clemens, a 25-year-old nurse working at the University of Maryland Medical Center Neuroacute Care Unit,
just follow my finger with your eyes.
a brain tumor was the last thing she suspected.
1 or 2?
2. I had severe headaches, nausea, and then the final thing that really, I knew something else was wrong was my vision. I started having double vision.
Go over here. Left eye.
And that started to affect
right
my walking.
Say wiggle when you see my finger wiggle.
Wiggle.
Her initial MRI scan was quite impressive. There was a large tumor on the right side. You can see here this whole area of the posterior lateral ventricle on the left is present, but on the right side it's absent.
Successful outcomes for Dr. Woodworth's patients stem from the research he begins in the operating room and the unique collaboration of neurosurgery with multiple departments under the umbrella of the Brain Tumor Treatment and Research Center.
Our group, which involves, includes the radiation oncology department, the pathology department, radiology department, medical oncology department, we all work together weekly to take care of our patients, but we also think broadly about what we can do together to develop new treatments.
With each patient, Dr. Woodworth continues moving forward the innovation available at the Brain Treatment and Research Center, transforming the future pathways of medicine while making possible miracles for patients of today.
If you were to give it a number and say maybe 80%, 90%, 100%, compared to where you were?
From before, I would say 100%.
Okay, great. What's amazing to me is she's downstairs taking care of my other brain tumor patients. And so I can only imagine what it is like for her to be caring for somebody just like her who's gone through this and help them through it.
Yeah, I mean, he saved my life. I don't know what I would have done if I hadn't been in the city, in Baltimore, if I hadn't been fortunate enough to be referred to him. I don't think it would have turned out the same way. So thank you for saving my life.